we needed to go in a different direction with the idea that, again, there are many public health concerns that we're going to have to address. And what we needed to do is, again, build a team now to be able to, again, address those issues in the coming months. And those issues range from, as we know, physical activity, lack of, for childhood obesity. We're looking at minority health issues and social determinants of health, and all the things we've talked about. So we set on a course to figure out how can we get somebody in to actually help us do that. That checks off a number of boxes. Let me start off by saying the medical director. For the health department, a medical director just needs to be a medical doctor. So again, that's a checkoff box that's relatively easy. But internally, we needed to have other checkoff boxes. We needed somebody that I felt understood public health. And I'm going to let Dr. Cadigan talk about himself here once I kind of introduce him a little bit. So Dr. Cadigan was a board member for the Ottawa County Health Department. Dr. Cadigan also is a physician in the city of Port Clinton with rights to Magruder Hospital. I'll let him talk to you a little bit about that as well too. He has residence both in Port Clinton and Ottawa County as well as Toledo. He comes with a number of boxes that I was really looking to check off. Those boxes, again, range from a shared vision of what public health should look like. Where do we need to go? How do we build relationships? And then how do we really address all the issues that we have in our community? And knowing Dr. Cadigan for a number of years, both socially and professionally, again, this was a logical choice at this point in time. We did look at other doctors over the last couple months, just had conversations with them. This unclassified position, we just felt that at this point in time, Dr. Cadigan was a best fit. Again, Dr. Cadigan comes with a myriad of different ideas and possible remedies to some of the issues that we have in our community. Some of the things that Dr. Cadigan and I talked about, again, a new way to actually look at the medical guidance in a community for a public health system. And again, we've talked about this, and I really like the ideas that we both bring to the table relative to that. Such as, we have multiple systems here. Dr. Cadigan is not tied to one system here, and that was important to us. So there is no siloing, there's no bias, there's no perceived, individual who is in one entity versus another. So again, that was important. But the reason why is that we want to build a system in the community where, again, everybody has some skin in the game for public health. So we want to reach back into the hospital systems with the help of Dr. Cadigan to start building that. And what I mean by that, every hospital system has a unique characteristic in this community. So what can they latch on to that we can together, each system individually, move something forward, but yet in a group? So again, University of Toledo has the medical college, and so their skin in the game could be helping us move things forward through the use of students and actually working on research projects and things of that nature. So that could be their gift to the community. Again, this is just a vision. It's going to take us a while to get there. But I think the one thing that Dr. Cadigan and I really want to promote is this idea that just not one doctor knows everything. And that's important. We have so many different issues and crises in our community at any point in time that I believe, and I think what Dr. Cadigan believes too, is that we need to get a group of medical professionals, medical doctors in different disciplines to actually form a think tank for our community that meets once a month, once every 3 months, whatever it might be. Again, we need to plan this out, but actually sit and talk about issues and what is the best path. Again, having those doctors reach back into their own hospitals and their own systems is a force multiplier for us. So there's a lot of great things that I'm hoping that together with Dr. Cadigan, the board, and our staff, that we're going to be able to eventually move things in a different direction for our community. Again, it's a unique way of thinking about it. As with any hire, with any individual, you check off as many boxes as you possibly can. Any gaps or anything we fill in behind that. So with that said, Dr. Cadigan, would you mind just briefly introducing yourself? I know you have patients to take care of today, but again, he'll be available in the future for further discussions if need be. So Dr. Cadigan, please, if you would.
Good morning. Happy to speak with everybody. I think the commissioner laid out things very succinctly in terms of where we'd like to go from here. Very excited and honored to be able to take part in this position. Just to give you some idea of my background, I am a Canadian trained physician. I've been practicing in the US now in primary care for 25 years. So as we move forward, certainly within the US, whatever our system looks like within the next few years, I feel that I've got a good background in both systems. Whether we end up moving towards more of a national healthcare system or a two-tiered system, the Canadian system is a lot more public oriented that way. In my own personal background, I did serve on the Ottawa County Board of Health. I served as a clinic physician there, as a medical director at a local nursing home. And for the last 7 years until the end of this year, I'm served as coroner in Ottawa County. So I've taken part in disaster preparedness, worked with our local EMA, and we've done a large number of talks and community meetings throughout the community on our other large public health issues, certainly which is the opioid issue. And I've had some discussions already within the health department in terms of some of the programs that we're going to be working with that. I've kind of crossed paths because I've had infectious disease experience through our hospital committees and quality care experience through certification in the hospital committees. And I come from a background in the family of public service. My dad was a firefighter for 35 years. My sister is a public health nurse in Canada. And in terms of my own experience in my practice, I've seen a wide range of people now within the community for 25 years. And I feel that we can work well as a group with the staff of the health department that I've met with so far. I think we've developed a good rapport in moving forward. As the commissioners mentioned, certainly I will not claim to know everything about everything. And I think any provider, physician that claims to know everything in all areas certainly cannot completely understand every facet of medical care and public health. And our goal would be to certainly pull in a consultatory form or a committee form, an advisory group through the Lucas County area, potentially infectious disease physicians with experience in minority health and gynecology in terms of the prenatal care and the early childhood aspect, pulling pediatricians in. So that way we've got a broad spectrum with myself serving more as a quarterback in that capacity, rather than relying on the knowledge of one person. If we had strictly an infectious disease physician, which is certainly something that would be very important in the times of COVID right now, then we don't necessarily have that experience in dealing with our pediatric issues in our Shots for Tots clinic, if our prenatal issues in our Healthy Start clinics. And I think we need to kind of work forward outside of the box where we've had one single person doing everything and kind of pulling the Lucas County community in, the medical community as a cohort to help in public health. I'm excited about it. I've had two kids that have been in school in Toledo, and I've spent a fair amount of the last 6 years, particularly through the winter at our home in Toledo. As I look forward as to where we go, and particularly as this is the COVID update today, we focus strictly right now or mainly on the infectious disease aspect with the COVID-19 transmission. But if we look at where we go after this, how we look back on this whole experience and how we prevent and deal with such issues in the future, then the highest mortality rates, certainly in COVID, are tied into particularly obesity, diabetes, hypercholesterolemia. There was a large study yesterday in one of the internal medicine journals that discussed the US mortality rates and what those risks are. Those are chronic health and public health issues. Those are things we can tackle and make a difference of, not just for the short term, but in the long term, so the next COVID, the next Spanish flu pandemic comes along, we have a healthier population to step in and tackle that. So, public health is supposed to be, and I think we look at my background, I've been able to tie in enough of those areas to hopefully serve as the quarterback, working in conjunction with the commissioner and the health department to move us forward on that.
Dr. Cadigan, thank you so much. And again, I know from my standpoint, knowing you for so many years, you do openly and honestly talk about issues. There are times that there's disagreements, and that you've worked those out. And so again, I'm really impressed and excited to have you a part of the team and to see really where we go. Being a trusted physician, but also a trusted individual, is extremely important to any team building, and the truthfulness to the community is what I think this department has been trying to pride itself on, to make sure that we are as informational driven as possible to the community, and letting them know what is going on, especially like today with COVID. So I know that I do believe that you're seeing patients today. I would like to have the media take some time right now to ask some questions, but again, please understand
Absolutely.
that media, that Dr. Cadigan will be available for further discussions if you need him. So
I am certainly, Eric, I'm certainly available as well. I know in speaking with some of the media in Toledo through the coroner's issues over the last 7 years, not all county, I'm sure at a number of these agencies, people realize that generally if they call me, I will get back and speak to you. It may not be immediately if I'm in with patients, but certainly I've told people across the board that if you have questions, you have concerns, you contact me, then certainly towards the end of the day or otherwise, I will get back to you at some point and speak with you with regards to that. And that holds true in the public health aspect of things as well.
Thank you, Dan. So Shannon, I think you want to referee some questions here?
Sure.